I'm John Chaplin. I'm a head and neck surgeon. I trained as an ear, nose and throat surgeon, and during my training became really interested in doing head and neck cancer surgery. Head and neck cancer covers a whole lot of different diseases, and essentially you can break it down into the tumours that involve the mucosa or the lining of the upper aerodigestive tract, and that includes the nose and sinuses, the mouth, the throat, and then the voice box. And then we also include in head and neck cancer tumours of the skin that metastasize to lymph nodes. Now, a lot of those cancers are related to smoking. Smoking rates have decreased over the years, and so we're seeing less of tumours of the tongue and oral cavity, less of the larynx, but we're seeing an increase in the numbers of tumours of an area we call the oropharynx, which is the throat, and that includes regions such as the tonsil and the base of tongue. And those tumours are related to a virus that we're seeing in the community called human papillomavirus. It's the same virus that is involved in causing cervical cancer. So over the last 20 years we've recognised that HPV has been involved in causing a new type of head and neck cancer, squamous cell carcinoma of the oropharynx. Over the last 20 years or so, the number of those patients presenting has doubled. There are probably around 350 patients per year that present with squamous cell carcinoma of the oropharynx in New Zealand, and the vast majority of those, somewhere between 80 and 90%, are now HPV related. There is a vaccine available that can increase resistance to infection with that virus, and that has been well demonstrated in patients who have been treated who have been vaccinated against the virus for the prevention of cervical cancer, and we would strongly recommend that people were vaccinated. Yeah, there are exciting developments in immunotherapy, and one of the drugs that's been shown to be very effective is a drug called Keytruda, and that has been demonstrated to have use in melanoma, but also has been proven to have use in head and neck squamous cell carcinomas. Now, unfortunately, the drug's not funded here in New Zealand at the moment, but we are working with MSD, the pharmaceutical company that produces the drug, and lobbying with Pharmac to try and get that across the line. And obviously, preventing having cancer is way better than treating it. And the things that we would suggest are obviously reduction in smoking and alcohol consumption, and vaccination is very important. In fact, our government funds vaccination for young women and young men to prevent the virus, and I would strongly encourage that people took that up.